So next question is the give reason. So in that first question is WBC count is monitored in patients on chemotherapy. Why WBC count is monitored on patients undergoing chemotherapy? That is the question. So most of the chemotherapeutic agents is having myelosuppressive factor. So myelosuppressive matlab, what do you mean by myelosuppressive? Depression in the bone marrow function. As a result of the depression in the bone marrow function, there will be decreased production of RBC, WBC, granulocytes, platelets and all. You might be knowing this, you might have studied in the first year still. So there will be decreased production of this cell count. Okay. So usually it's the most important factor that we have to check the cell count before adjusting the dosage of the chemotherapy. Okay. So if the doctor has to see the cell count before the chemotherapy. Okay. So if there is a decrease in the WBC count, it indicates the patient is vulnerable to infection. Right? Okay. So most of the chemotherapeutic agents is having this myelosuppressive property. So usually after 7 to 14 days after receiving the chemotherapy, if you check the blood count, there will be depression or decrease in the cell count, whether it is RBC, WBC, platelets or granulocytes. So if there is a decrease in the WBC, the patient is susceptible to infection. So during this time, it's the nurses, due to whoever is there in the department, has to see or monitor the patient for fever, signs of infection or any fever, or you have to see the neutrophil count is less than 1500 cells per millimeter cube. So it clearly indicates signs of infection. If it is less than 1500 cells per millimeter cube, or if the patient is having fever. Educate the patient about the importance of infection prevention, about the importance of prevention of injury, bleeding and all these things. Okay. So as the question is, WBC count is monitored in patients on chemotherapy because less WBC indicates patient is vulnerable to infection. So we can conclude the topic. So the less amount of WBC indicates there is less immunity or there is immunosuppression. So in this case, here the less immunity or less WBC is due to the cancer treatment, can be either chemotherapy or radiation therapy. The main function of the WBC cells or WBC is to protect our body from infection. So when there is a less amount of WBC and if the patient is getting infection, the body is not able to fight against the infection. So the body is vulnerable, the patient is vulnerable to get infection. So what all things we have to do is that once we have to adjust the chemotherapeutic drugs always after seeing the cell counts. Once the cell counts returns to normal, we can start the chemotherapy or we can adjust the chemotherapeutic dosages. And another thing is that what all this we have to see during this time, I already told, avoid infection is the first and the foremost thing. Avoid contact with infected people, avoid going to gatherings, crowds and all, and eat plenty of like nutritious food, balanced diet, rich in vitamin. Fruits, include fruits and vegetables in the diet. Then first and foremost thing is then avoid injury. If there is an injury, there is that platelet count also, so there will be bleeding, and because of the less WBC count, that injured area will get automatically get infected also. So our first and the foremost thing is that avoid any type of infection when the WBC count is less, because chemotherapy patients are more vulnerable to get infection when there is less WBC.